Obstacles cannot stop this. Tell yourself you will rock this, and you know you will top this. Anything try to block this, coming at your own risk. It's the best thing you'll ever see. Put that in your memory. Ain't nothing better than me. I see the best thing I ever see. Thank God for this energy. The Father keep blessing me. No way of the remedy to bring all the best on us, the best. The best on us, the best. The best on us, the best. The best on I'm so blessed. So blessed, Lord, is the best thing. I know I'm not resting till I tell you rest. That it's always the best. Yes. Yeah, cause I'm not better than you, and you're not better than me. Raise your hand, let me see. Cause the best is in our way. You're not better than me, and I'm not better than you. But the negative things you do, that will make me better than you. Yeah. And every morning I wake up and I pray and I thank the Father, and I thank Him for life. For life, yeah. You give me the heart of a lion and the wings of an eagle, and I must find my way, much touch the skies, yeah. Cause I'm the best thing I ever see, boy. I say the best is inside of me, yeah. Go be the best thing you could ever be, boy. I tell you nothing not stopping me. So bring on the best, that's the best. The best, that's the best. The best, that's the best. The best, I'm so blessed, Lord, that's the best thing. I know I'm not resting till I tell you rest. That it's always the best. Yes, cause I'm not better than you.
And compassion as you mourn. Every day, we embark on the journey of life, and one day, the journey will end. It's on that day that you can entrust the celebration of life of your loved ones to David Williams Funeral Service. Call 718-291-3823.
Yeah. Ride along, welcome to the ride. Yes, you are the best. Boom.
Tell yourself that you got this. Anything that you practice. Tell yourself it's the
You are the best. The best, the best, the best.
Tell yourself you will rock.
And it's
And you know you will
the best day of the week.
anything try to
Well, every day is actually the best day of the week. As long as you get up in the morning and you take a deep breath, it's a blessed day, it's the best day. All right? Welcome to Ride Along Live for today, Thursday. Welcome to you. Nikki, how you doing? Wendy, Charles, how you doing? Peter, Joseph, how you doing?
I'm so blessed. So blessed, cause I'm the best thing.
Yeah, man. Hey, Shante, how you doing? Wendy, big up. Everybody share the program, put it on the page. Today we have, now we don't get this doctor very frequently, but when we do, it's always a bomb. I just realized that she's been on the program for probably the past 4 years or so. Dr. Katina Kennedy is here with us live on call, our gynecologist for all the women and also for men. We're going to be talking about it, guys. We are going to be talking about it. Yeah. Gail, how you doing? Big up yourself. Everybody share the program, put it on the page. We got Dr. Katina here with us live. Brenda, how you doing? Brenda, you're here already. Brenda, it's nice to see you, Brenda. It's nice to see you early. Yeah. Nikki Edwards, how you doing? Listen, I'm not going to start the show until I see that you guys share the program more than that. So Rhonda, do like Rhonda Charles. Sorry, Rhonda Ann Williams. And share the program. Share it. You share it once, share it twice. Lydia James, how you doing? Yeah, share it. Share it. Guys, we're going to be talking about so many things today, right? And we're also going to open up the phone lines because, when we say on Thursday, we say we open up the phone lines to vent about things that's upsetting you, things that's bothering you, things that's on your mind, things that are depressing you, all of those things. That's what we do on Thursday. And today, not only that, we're going to open up the phone lines for you to call and talk about things from a relationship and sexual perspective. but we have the doctor, the professional with us. And she's the best. She's the best. She's the best. Truly. Truly.
Yes, I am the
Best thing.
I know I'm not worth.
Hey, good evening to Nikki Edwards. Thank you so much. You share. Gail, thank you for sharing as well. Euleen, Alexander.
Yeah.
Hey, big up yourself, Michelle Lake. Thank you so much. 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 Yeah, let me see if all you're ready. Guys, we also live on in Brooklyn, New York on J1 the 107.9 FM. So for the folks in Brooklyn, New York that's listening, that's locked on, how you guys doing? Welcome to the ride. Welcome to the ride. Wendy, how you doing, Wendy? Wendy C. McGuire, thank you so much, Wendy. Wendy, you're the best. Lois JJ, thank you so much. All right, guys, so listen, I want to take up a large portion of the program because it's your program. It's your program, right? So it's all about you. You know, I was doing a research earlier, right? And research shows that almost 40-something% of women still don't visit the gynecologist. A lot of them self-diagnose, and it probably could be more. A lot of them self-diagnose, or they get diagnosis from a friend, right?
Put the camera.
And it's what,
He's talking.
almost 40% don't visit the gynecologist. Is that statistic true though?
They're all on there.
Is that really statistic is true? I don't know. We're gonna talk about that. All right. Nikki. Okay, all right, guys. Let's go ahead. Let's go ahead. Let's start up the thing. All right. Here we go, guys. Help me welcome the best. And she, again, she's not always available, but when she's available, she makes sure that she make her way on this program because this is a family program and she's a part of the family. Dr. K, how are you doing?
Hello. I am glad to be here. Yes, you all are family. I love coming on the show with you all. It's always a lot of fun.
Yes, it's always a lot of fun. And I always have a lot of questions. As today, I have a lot of questions as well.
Yes. So let me just introduce myself for those who don't know me. I am nurse practitioner Dr. Katina. I am a family nurse practitioner. I have my own practice here in Fort Lauderdale, Florida, South Florida. So if you're in the South Florida area, come by and say hello to me. I practice primary care. That means I take care of men, women, teens, and also kids as well. And I'm also specialized in gynecology. You know, that's my love, women's health. And when dealing with women's health, you know, we deal with a lot of sexual issues or questions as well. So that's where that sexual education comes in at. So I am glad to be here with you all. I'm here to answer your questions.
Yeah, and we will open up the phone lines for folks to call in and ask the question or vent or whatever they want to do on the program here today is their program. So I said at the top of the program, right? I saw a statistic. I don't know how true the statistic is, Doc, but it said something at about 40%, 35 to 40% of women do not visit a gynecologist. Is that statistic realistic?
You would be surprised that it definitely is. It may not actually no, 40% sounds about right out of 100%. We do have that amount of women that does not go and get their exam done. It's all about preventative care. A lot of times women they come to my office or any gynecology office because they're having issues even when they come like for their well woman exam, because you should have your well woman exam once a year, everybody. That's right. You're supposed to go see your doctor or your healthcare provider and get your pap smear done, get your ultrasounds done to take a look at your ovaries and your uterus and do your breast exams as well. So I want you to do that once a year. But yes, many don't. They just go in when there's something going on. But preventative care is key, y'all. Ladies, we got to do better with going in and getting ourselves checked out.
Yeah, I was shocked because I always said that women far surpass men in going to the heart to the doctor. Like men, they have to see something falling off before they decide to go in. Some men, by the way, I mean, I check myself pretty often, but a lot of men sometimes they have to see something falling off, or you have to fall off before
Now,
they
for
actually go in.
yeah, I mean, women will, you still go more often. We still beat the men now.
Yeah,
We a lot of times the men go, like you say, to the doctor when there's an issue going on. But I have recently that a lot of my male patients that's coming in, it's due to their significant others or their family members. So y'all keep encouraging these men to come on and get their physical done.
yeah. All right, Doc, let's go in. Let's go in straight in. One of the things I want to touch on today is premature ejaculation and delayed ejaculation. And I saw that you did a video on those topics. So we're going to first talk about delayed ejaculation and how could women play a role in helping men with delayed ejaculation and what it is in general.
Yeah, yeah. So I brought up those topics because a lot of times most people are used to me talking about, common women issues. However, there are issues that men experience as well. And premature ejaculation and delayed ejaculations are very common, believe it or not. A lot of people, I get a lot of inboxes from men and they say, my woman is frustrated because it's taken me so long to ejaculate. So let's talk
Oh,
about delayed
hold on. Women like when you go that long. Women like that long, you know, 5 hours, don't it?
So some it depends now because after a while, some women actually dry out. So, it's important that, you stay lubricated during that time. But, if you're not having, well, remember, we're talking about the whole sexual experience.
Right.
So we're not the penetration for hours, the woman's gonna dry out. It can get repetitive. You gotta mix it up. You gotta take out the penis, you gotta do oral sex. And then, yeah, with the condom, you have to make sure you change the condoms because if not, the spermicide, it actually decreases the effectiveness and so forth. But delayed ejaculation, that's basically when, it's the male have an issue with having coming. They don't come. It takes hours. And sometimes they can't come via the vagina. I've had couples that come to me and they can't conceive because the man just can't come from vaginal penetration. And the reason why is sometimes it's because he's used to masturbating so much with his hand and
Mm.
with his friction. So when it's in the vagina, it's just not the same. So and then sometimes too, anxiety can play a
Uh-huh.
role, mental can play a role. Sometimes if you're having sex too much, you're not
Oh.
gonna, that's gonna interfere with you ejaculating sooner. So those are just some common causes. But you definitely want to make sure that the reason why foreplay is important is because you have to intertwine that because that can be frustrating for some women. I don't know. Some of you women out there, do you want a guy just, straight penetration for 2 hours
But
or an hour and a half?
some of them say they want the stallion. They want the stallion. They say they want to stand on it long. They want to stay long. That, most men think that if they're doing it for hours, at least an hour, then they're strong. They back strong, isn't
An
it?
hour is typical. You don't. It's just that sometimes it's longer than an hour.
Mm.
So when it's longer than an hour, then that's an issue. But yes, so you definitely because the average usually runs about 30 minutes. The average penetration from a male Just like Rona says, yeah, it can get boring. You can change positions how many times?
Mm, mm,
So you have to make sure really just, and that goes back to what I've said over the years, just on your talk show, you have to go back and explore the body. Don't be so in a rush to engage in penetration. Discover your erogenous spots. That's your hot spots. What makes you feel good? Behind the knee, um, behind the ear, the neck, sometimes the nipples for the men on their chest. Yes, nipples. Men like nipple stimulation as well. So that's the time where you communicate with your partner, take your time, and really engage in foreplay during that time when it comes to delayed ejaculation. Because it's fun, yes, but if every time, sometimes you want those quickies, right, before work or when you get home. But if every time he takes 2 hours to come, it can get frustrating for some couples.
mm. So men, get it. Listen, if you go in hour and a half, 2 hours, and you think that you're a stallion, you're actually probably doing an injustice to the woman. You're just boring her to death. As the women and them saying here, look at somebody said, it gets boring. It has to be exciting, right? You have to do exciting things. Just bonging and panging and boinking at the same position all the time. It gets boring. You gotta change it up. You know what I mean? Use different tactics and nice up the thing a little bit as it does. You right, doctor?
You got it. You got it. Engage in some massage. Use the massage oil, and make sure you stay lubricated as well. Somebody says, I can't read that one. It says an hour, Junior. No minutes or something. I can't read her comment, but
This guy's a troublemaker. Don't even really post. He's a troublemaker.
oh.
He's a troublemaker. No, 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 no. But that is important. Now, the opposite is when you ejaculate too fast now, right?
Yes, yes.
How do you control that? How could men control that when they just come too quick?
Yes. So with premature ejaculation, so that's basically when you come like less than 3 minutes, or you come before you even put it inside of the vagina or the anus. Over the years, I've had couples where they come in and, after just the female touching, kissing the female, he's ejaculated. He's came. The semen has come out of the penis. So this issue is actually common. It's not uncommon. Um, some of the reasons can be um, inexperience. If you think about when you first started having sex as a man, you came really quick. You have to know how to control it mentally, right?
Right.
And then also sometimes anxiety, mental disorder, emotional problems, fear, if they've had trauma in the past, those are some things that can cause premature ejaculation. Also, if you have erectile dysfunction, you're not getting adequate blood flow to the penis, that can cause premature ejaculation. Um, Emotional disconnect from your partner sometimes can cause that. So it's you have all of these emotional issues, psychological issues, but some of the things that you can do is you have to definitely somebody say they break before entering, and that's really what happens, unfortunately. But they have those numbing gels and creams that are out there, so you can go to the adult store or order it online, because that helps numb it. That way, they don't feel so much of the sensation of the vaginal secretions, and it makes them last a little longer. Also, using like a thick condom or a condom can delay the ejaculation to more than at least the 3 minutes or a minute. Um, Also, engaging in foreplay and having the female or your partner, because you can have a male partner, uh, just so that they can go ahead and they can feel pleasure too. So making them have an orgasm, so that when you enter and you come really quickly, they're satisfied as well. Because if you're in a committed relationship and you don't have any other partners, you want to be satisfied as well. So you have to make sure you engage in that foreplay during that time as well. And then, Junior, if all fails, they definitely have medication for it. They
Mm,
have medication that helps prolong the ejaculation. I actually work for a company, a telemedicine company on the side, that does nothing but prescribe medication to men who have premature ejaculation.
mm.
Yeah.
If a man masturbate too much, could that aid in his premature ejaculation dysfunction?
Actually, that can help. I'm glad you brought that up because that's one of the things that can help premature ejaculation. So, say for instance, if you know you're going to have sex with someone, with your partner that night, it's recommended that you ejaculate, okay, like an hour or 2 hours before the sexual intercourse. That way, you can last a little bit longer. That way, the semen isn't so fast to come out of the penis. So you see what I'm saying,
That
Junior?
is not kind of like problematic. Like if you come once, why you want to come again for? You know, you gotta take
Yeah.
time. You gotta let it back build back up. You know what I mean? You can't come back to back like that. A lot of people have problems with that, doctor.
Yes, yes, especially the older you get. When you were younger, you could do that, but the older you get, at least you gotta wait a little bit of time between the sexual episodes. But you have a lot of adults that still go back to back. They have
I
sex.
mean, I could handle it. I mean, I'm at the age where I'm still at my prime. You know what I mean, doc?
Ah.
I I could tap myself on the back 2 times for that. I'm on my prime, but there's some people not at that prime like me, and a few. I'm not seeing anyone else. Everybody else is past that prime, but like me, I know how to control it. I think I'm experienced in that department. It's all a mind thing, doctor. If for a man perspective, it's a mind thing. It is all in the mind, and you have to know, and that's between me and you, because nobody else is gonna hear this. If you reach to that point that you feel like you are almost there, you just stop. You pull out, you stop a bit, and you do something else.
There you go. Good
Yeah,
tips, Junior.
Doc,
Yes, you're giving some good tips.
doc,
Because there are a lot of men that suffer from this. So by you giving them that tips, that can definitely work. That's some they call it edging. I don't know if you heard of that before, but edging is basically that's a technique that you can do. If you look up, it's in the porn world. But if you look up edging, you basically you're masturbating, you okay, and then you all of a sudden when you're getting ready to come, you stop. And so by practicing that, they call it edging, that helps with the premature ejaculation as well. So there's some techniques out there that can definitely help. But yeah, these are common disorders, and ladies, men, we got to be patient with our partners, so that the relationship, because it's not all based on sex, but we have to be patient. We have to work together, communicate with your partner, and just let them know what's going on, and y'all work together. Sometimes you have to use toys. Like I say, you have to make sure your partner gets satisfied. If you know you have premature ejaculation, you have to make sure that you satisfy him or her first before you insert.
yeah, yeah, it's important. It's important. And I hope you guys get the message, man. We've been talking about this for a long time. We've been talking about this for a long time, man. And another thing, doctor, we mentioned it before. And I don't know, a lot of men still don't understand because women keep complaining, right? A lot of men think that it's all about just banging and banging and banging and banging and as I say, mash it up. Yeah, I go mash it up. It's not all about banging. You have to be skilled in these things, doctor. Give them some tips, doctor, on the best way, especially in penetration, to make it feel good for the woman.
Yes, you have to definitely switch it up. You don't want to be a rabbit. Just go and go and go and go and go and don't stop. As you get older, you have to change positions. When you're having penetration, take it out, do some oral sex, have her to taste herself from your penis, give you some oral sex. And then also you give her oral sex. You guys, kiss, look at each other in the eye, really connect with each other, so that you can continue with the mood, and the vaginal secretions will increase as well. And yeah, so that's and as far as the banging,
Yeah.
and you don't want to do that so much because women can actually have what they call uterine spasms. Ladies, I don't know if you've ever experienced this, but when you're having sex and then all of a sudden you get this extreme cramping to the bottom of the lower abdomen, and like you're having your period, really bad cramping, and that's because he's constantly hitting your cervix with the penis, and it's causing your cervix uterus to spasm. All right. So a lot of times, if you just put like a cold compress there, drink a cold water, and have him to stop for a little bit, that'll help. But if you feel it coming on, ladies, don't be afraid to switch it up, get on top, you take control, and slap him around, choke him around a little bit.
No, doctor, I said choke. That, that choking thing, doctor. That
some,
choking,
some
doctor.
some men like that. Some men like that. That's why it's all about communicating with what your partner likes. He likes to be dominated sometimes as well.
Doctor, doc, I'll pass on the choking thing. Don't choke me. Don't choke me. I can't not by it. I personally, but some people like it. Huh? I don't blame them. They probably like choking and all this stuff, but that choking thing can turn me on, doctor. I feel like you're trying to kill me or something like that. If you're choking somebody and you're in the moment, what if you kill them? What if you get too much in the moment and they end up dead, doctor? Some people can't control themselves.
Well, of course, it's that soft touch. Oh, we got She says tie him up. So, she likes that kinky, like to be tied up. So you have to, figure out what you actually like, and because a lot of women like to be choked, and you guys do it. Someone says violent sex, violent coitus.
I'm probably old timeish, doctor. I'm probably old timeish, but that choking thing that was for another generation. But if you like it, you like it. That's up to you. You do
Uh-huh.
what you like. But listen, guys, this is your show. We're talking to Dr. K on the program, and we're talking about everything. Right now, we're talking about orgasm, right? We talk about men who ejaculate too fast, men who ejaculate too slow. But Doc, what about women who don't orgasm at all? They don't
Yes.
have an orgasm. What's happening there?
So it's twofold. Okay. So number one, sometimes it's not that she can't have an orgasm. It's just that the male orgasms before her. So a lot of times.
Uh-huh.
So, by the time sometimes it just takes longer for a female to get there. Also, it's mental. A lot of women are not relaxed mentally. They're tense. They're thinking about something else. They want to get it over with. Sometimes, not all the time, depending on what it is. And it's just they're just not there. So the woman, and then also you have to know your spots.
Mhm.
So I don't know if any of you all bought my master class, but you can go to my website, drkatinakennedy.com, and view my 12 types of orgasms class. I
Mm.
talked about how to get different orgasms. You have your U spot, your A spot, your G spot, your cervical orgasm, your anal orgasm, your nipple orgasm, your mental orgasm. I'm not going to go into detail. I talk about it all in the master class. So you can go to my website, purchase it. It's the recording of it, and you'll learn about how to get those orgasms. But you have to know first, ladies. So I encourage you all to explore your body. You should be able to get on top of a man and manipulate his penis to the area that feels good to you, that you have an orgasm. Yes, ladies, I said it. You have to make sure you know your spots. So explore your body a little bit more. And my website is Dr. Katina, DRKATINA, Kennedy.com. Somebody write that somewhere, maybe on Facebook,
Yeah,
and pin that somewhere
yeah,
for me.
pin it for me, guys. Doc, I learned something new today. I never knew for the life of me, Doc. I never knew orgasm was like alphabet soup. It comes in.
Ah, actually, there's a lot more. I just talked about the 12 types of different orgasms, but yes, there are a lot more. It's a lot of orgasms out there. but especially the mental orgasm. And a lot of times we're not taught to mentally be intertwined with our partners, especially if you're in a committed relationship. If you're having sex every day, or every other day, it's it can get monotonous, especially if you're not bringing anyone in. It's just you two. It can get monotonous. It can get routine. You gotta spice it up. You gotta do something different. You
Mhm.
gotta explore each other. Learn your spots. Do you know where all of your spots are? Men, women, I encourage you all to find a new spot. Find a new spot for your partner. That's a spot. Sometimes I had one person that said, I had someone to lick my chin, and that really turned me on. The licking of my chin turned me on. So, really it's about knowing where your spots are. Oh, Spice got a question.
Yes, she got a question. She said, Doc, what do you think about using herbs for increased libido? Talk a little bit more about that, please.
Yeah. So there are a lot of different herbs out there that can increase the libido. They have the maca root, and they have I'm not a herbalist, so I don't know about all the herbs out there. So if you know any, you can go ahead and type
Honey
those
goat
in.
weed. The honey goat weed.
Okay, there you go. I know that helps with no, that helps the men.
I have them.
I don't know about the women, but maca root, I know DHEA is a
Uh,
good supplement as well. But those are the maca root is the one that I, mainly know about that really helps increase the sexual. If you know any ladies, men, go ahead and post it.
mhm.
But yeah, I told Spice, I totally think that those work really good, and they are definitely beneficial. At certain points, it may stop working. You do have to be consistent with it. So, a lot of my female patients, they usually try those natural things first, and then they come in, and then I have to give them, medication that helps. Because there are medications that's out there, like the Addy in the states here. Unfortunately, it will not be covered by the insurance. It's crazy. It's still not approved. However, there is some couple medications out there. But yes, herbals is really good. Someone says maca root will make your butt spread and get you pregnant. Ah,
Hey guys, this is 717-015-720. Let me open up the phone lines if you want to ask a question live on air. Dr. Christina is here answering your questions. 718-701-5720. Doc, you spoke about mental orgasm, right? And getting
mhm.
the woman to that place mentally. But one of the things I know that people have to pay attention to, from a man perspective, I know, from a man perspective, is you have to be in a place that you feel comfortable, right?
Yes.
And the man is all about what he see, what he smells, what he
Ah.
whole vibe of things, right? So probably your favorite perfume, it's something that keeps the vibe going. But at any point in time, anything that comes in that disturbs the man mental state, like a odor or some sort, it will throw the man off, doctor. It happened to me before.
Yes.
And
You
the
have
night
to
after
find out. Yes, you have to find out what turns your partner on, and that's part of that communication. And I have this saying that you never ever have a bad sexual intercourse. No, you should not. And the reason why is because you should always. Can you hear me?
yeah, I could hear you. I could hear you.
Oh, okay. It went silent there. You should
Yeah.
always communicate with your partner, even when you're sexting, prior to the sexual intercourse. Oh, baby, I like my nipples softly licked on versus biting. Don't bite me. That turns me off. Say it nice and softly, even during sex. If he or she is doing something wrong, let her know. But you're gonna do it in a nice way, of course. Oh, baby, keep doing it just like that. Not like that, but like this, so that, she or he knows that you're doing it right. But
Hmm.
yes, you have to turn your partner on. If he likes that lingerie, if he likes to smell good, you do that. But you do have to be connected emotionally with your partner as well in order to be there. You have to be emotionally connected, physically attracted. I know once men and women if you're not emotionally there anymore. You know, think about when you have sex with this random person and then you have sex with someone that you're emotionally connected to. The passion is amazing with the one you're emotionally connected to. So ultimately, the sex is going to be, a lot better. So it's just good when you can just mentally, emotionally connect with that person, and the sex is gone. It's taken to a whole nother level.
Yeah, yeah, absolutely. And also, Doc, I mean, I'm no professional, but I have a couple pointers. Get out of the bedroom, guys. Too much bedroom action. Go to kitchen. Do it on the couch. Goddamn, do it in the veranda.
I like that. Those are some good tips, Junior. You're right about that. You have to change that environment up. Don't make it routine because that's how it gets boring. And then you don't look forward to it. You're like, oh, here we go. Continue to date. That's important. Play some songs. People get out of the music. Music is amazing, does amazing things to the soul. So play your favorite song that you like. When you're driving home from a hot date, go ahead and suck his penis, while you're driving home from the restaurant. Do some, things that you would have done if you think about when you were younger, right? You know, go to the
You're the real
theater.
deal. Doctor, you are the real deal. You are the real deal. I hope the women are you listen to the doctor. Listen to the doctor. You on the highway, you going on a long drive, pull over on the side of the road, do it in the road.
There is spontaneous.
Spontaneous.
Yes, yes. I like that tip. Yes, you definitely gotta you have to change the environment. And even sometimes, like if you're married, do a hotel room for a night. Go get a room. Go get a room and have fun. If the kids are old enough, let them stay at the house or have them, to go with a family member and just, go in a hotel room. Like I say, act like you were when you were dating. You got hotel rooms, you did it in different places, you sext each other, you sent hot pictures, to someone. So, you got to keep that up, ladies and gentlemen, as well. Gentlemen, don't get complacent. And then, ladies, just a reminder, men like to be felt that they are wanted as well. A lot of times I hear my male patients saying that, I always have to initiate sex. Women initiate sex as well. When they come home, let them take a shower, or if you're into that kinky, sweaty, stinky sex, soon as he gets home, pull down his pants, give him some oral sex, and then let him go shower and so forth. But just mix it up, have fun, initiate it, because a lot of women don't.
That is so right, doctor. Women would lay in bed and they're horny, they want it, they want to have sex, but they would stick their butt on you, they would do all kind of things than to initiate it. Women, do if you want it, take it. It's there. Do it. That more women need to hear that, doctor. I'm telling you, more women need to hear that because a lot of women don't do it. They don't.
Got it. Then we got Brenda here. She says some men make the thing boring and monotonous. Yes. So that means you spice it up. You tell them what you want. You should never ever have a bad encounter. You are ruling it. You let them know what you want. Let them know how you like it, what you want, and you go for it.
Yeah.
Somebody, Kathy says she asks for it. Okay, she goes for it.
Even ask for it, take it. Patty, asking for what? Take it. 718-015-720. Guys, we're live. We're also live on J1 FM 107.9 in Brooklyn, New York. We're talking about this is adult conversation. This is human conversation. Nothing provocative about this conversation, guys. This is human conversation. This is about sex, and we all experience sex. We were produced because of sex. We're talking about the best ways to please your partner. The best ways to please your partner. All right?
I'm loving all of these comments. Vic says he likes the nasty shit.
Oh, no. And, and, and,
Tanya,
and listen, I tell you this, guys. I know some women might say that they love the nasty ass things. But listen, a few women messaged me after the program last week when I said, women, you must wash your ass. And they said, men must do it too. Men must take more time in cleaning themselves. Make sure
Yes.
they don't smell bad because the women have to get in a vibe too. And if you smell stinky, I mean, they like stinky stuff, but not stinky, filthy stuff. Like sometimes it just turn off anything. A dog would walk away from you. You don't get that. Clean yourself, men. Take a nice shower. You know what I mean? Take a nice shower, put on deodorant and stuff like that. All right? Men,
and
this
that's
is a free tip.
and that's important because men don't realize, well, hopefully they do, but the balls can get sweaty and the balls can get musky as well, especially if you have
Yes,
a lot of hair down there.
yes.
And then if you really explore the body and you like giving your male partner anal, if you like licking his anus area, then you got to make sure that he cleans that area as well, and he got to make sure he cleans it as well.
Like you
And
always go too far. You always go there. You always go there.
I'm real. I talk about it all because some men do like their. We have some men that's all that goes all out. They get on all fours, right? And they like their penis sucked from behind, and they like their anus licked as well. So you have to be open minded, and like I said, it's all about knowing what your partner likes. But yes, you have to make sure that you cleanse, and then talk about different soaps. Men, you can affect your woman, affect, not infect, but affect your woman as far as changing her pH. So if you're using scented soaps, lotion on your penis that's scented, if you're having sex with her, guess what? That can throw off her pH. So just make sure you use your unscented soaps, and just like women we have to use unscented soaps to clean ourselves, because if not, that can change our vaginal pH, and that can cause the bacteria vaginosis, which causes the odor, or it can cause the yeast infection as well. So, and also make sure, and I want everybody to do the tongue check. Stick out your tongue and look in the mirror, and if your tongue is coated with white coating, if it's a lot, and we're not talking about minor, but if it's thick white coating on your tongue, you may have some yeast on your tongue. And if you have yeast on your tongue, when
You
you're
can
doing
expect.
oral sex to your partner, you can transfer yeast. Now, we normally have yeast in our mouth, but when there's an overgrowth of it,
Hmm.
I know sometimes cigarette smoking, you guys know what I'm talking about. You've seen someone where they stick out their tongue, it's white. I wish I had a picture of it. I talked about it some months ago on my social media, but the white coating of the tongue, make sure you check that. Also, men use lubrication. Men, women use lubrication. Do not spit on the vagina. When you're spitting bacteria, you're spitting yeast into the vagina. So make sure that you use I have my all natural personal lubrication. So order my Sextivia from my website.
Hmm.
That'll help keep you going as well. But you want to do something natural, unscented, that's going to help. But no spitting. Look at your tongue. Make sure you use unscented soaps. These are some hygienic things. And then also, believe it or not, if you are having frequent sex and you're ejaculating in your partner every time, that can throw her pH off as well. If you notice that every time after sex she gets a vaginal infection, it's because you are ejaculate the semen and the vagina pH. It alters the pH. So I always tell, if you do have a high sex life, you have to ejaculate other places. Ejaculate on her face. Sometimes some women like facials. Some people like it on their body. Some people like to taste it and swallow it. So again, it's all about, knowing, communicate with your partner and knowing what he or she likes. And don't be afraid to explore. I know a lot of times, sometimes it's culture, especially in black people. You stick to the same things. You think certain things are nasty and this and that. Just try it, and then you can say, oh, I didn't like that. before you knock it. So
That's probably me. I have some things that I wouldn't try. But I don't blame other people who tried it or is
yeah.
trying it. I just kind of certain things I don't feel I like it.
Uh-huh,
Don't do it to
uh-huh.
me. Like I won't do it to women either. But that's everybody's choice. But Doc, you said something there. I want to go back on. I want to go back on a little bit. You said about women tasting themselves. And the other day I had a conversation with I think it was somebody, one of my previous guests that we had on the program. And we were talking about tasting themselves. And I'm like, taste yourself. Why don't you taste yourself? How important is a woman tasting herself? Like, talk to us about.
Yes, yes. So it's all about knowing your body. Anybody that follows me on social media, and if you don't follow me on my IG, it's at Dr. Katina underscore Dr. K. So DrKatina underscore DRK. Somebody pin that for me.
Mm-hmm.
But on my IG, I've talked about just the importance of knowing your body. I've
Mm-hmm.
had patients where they come in and I say, "How long has this bump been here?" And they say, "Oh, I never knew I had a mole there. I never knew this. I never knew that." No, no, no. You should know everything. You should be looking at your vagina. We wash it every day, right? But we have to look at our vagina as well. So take a mirror, look down there. You have to insert your finger, your clean finger in your vagina to smell it so that you'll know what your normal smell is. Some women taste it just to make sure that their pH is on track. So thank you, Gail, for plugging that in for me. But yeah, so some women they don't want to taste it, but you definitely have to know what it smells like and know what it looks like. Please, y'all, don't be scared. It's yours. Just like with your breast, you got to check your breast. You're gonna let your partner go down and taste you. You want to know how everything about yourself.
So in that way, nobody's surprised. Like you know what you're delivering, right? Like if you're cooking like a soup or something, and you don't stick your hand in that soup or take up a spoon and taste that soup, how you gonna know that the soup cooked good? How you gonna know that it's good? You gotta taste. I tell women that all the time, and they feel like it's gross. No, you gotta taste yourself, and nothing wrong with that. Taste it, do it. Yeah, I have no problem with
And
it.
then especially smell yourself. You do want to make sure you know what your vaginal secretions smell like. And then, like I say, take a picture, ladies. Take a mirror and look. Now, somebody before I forget, I think Spice asked that question. Spice asked really good question. She asked, "Does the COVID vaccine affect the the vagina?" I think she asked. But I just wanted to. She brought up the COVID. It is research that shows that if you do have COVID, you can transmit it through the semen and vaginal secretion. So there is some research behind that. So if you have COVID, you do want to, abstain from, of course, sex if you because you can transmit it that way.
Yes, 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 yes. I saw that research. Very
And then
important
and then
information.
Kathy says, don't forget to urinate before and well, she says after sex, but it's always before and after sex because what that does is it prevents recurrent urinary tract infections. You want to empty the bladder so that when you do engage in sex, the bacteria has no way, no place to reside in during the sexual intercourse. So make sure you urinate before and after sex. Have you some nice unscented wipes? Just say, "Wait a minute, honey," wipe, and then you're back in action.
Right. That someone asked me this question here about the effectiveness of a particular. I don't know what it is, but it's some kind of liquid of some sort or something that they put inside the vagina before some kind of spermicide, something that it before sexual intercourse, to not to somehow prevent from getting pregnant. Does that work?
Yes, yes, it does work. Yeah, if you do it, yeah, it's like the spermicide. It's an old practice, but a lot of women still use it. But so some women they can't take birth control pills or the shot or the ring, so they have to resort to these type of measures. But yes, it definitely works. It's not effective as the other ones. It's only about 94% effective, But yes, they definitely work. Yeah.
Okay, all right, guys. Again, we're giving you guys an opportunity. I'm saying again, open up the phone lines. I know you guys have a lot of questions, but the questions are coming in fast and furious. If we missed your question, you could call in. This number on the screen right there, that's the number that you call, 718-701-5720. We're talking to Dr. K, giving us some information about sexual health, how to make a better sex life, right? And not just a better sex life, how to make a overall better sex life, right? The communication, the regular shower, and just presenting yourself. Men especially, sometimes women complain about that all the time, that they don't want to have sex with a man because he go to bed and he don't have a shower and he smells a kind of way and he turns off the woman. All of these things and then plays into sex. All of this stuff. Foreplay is another thing again. A lot of men don't like to foreplay, but you got to foreplay. You can't just jump into it like that. You gotta start the fire slow and then turn it up. And
Yes, yes. And we have the at the I Am Her Beauty Bar, she asked, does fruit, and I talked about this in the last live that I was with you all, does fruit make the vagina taste a lot better? And it definitely does for the vaginal secretions and the semen as well. Pineapple, yes, you guys have heard me talk about that. Pineapple specifically is one of the fruits. It's really sweet that does change the taste of it. So it does, and then also if you eat like a lot of spicy foods, you notice that'll come through the semen, and less water, that'll come through the semen as well. The semen is a lot more like spicier, and it's bitter as well. It's sour tasting.
I'm not gonna read that comment, Vic. Vic, you
Oh, I missed it.
hell. Vic going straight to hell.
Oh, I missed the comment.
7715720. And also, guys, we're live on J1 and 107.9. We're talking about sexual practices, healthy sexual practices. And Doc, we have to look at STDs a little bit. I know we speak so much about it, but we still need to speak about it because everybody thinking right now, the only disease that people get in these days is COVID. But there's still STDs that going around. Let's talk about protecting from STDs and how to check yourself for certain STDs. Hold on,
Before I forget,
hold on, sorry, Doc. Before you answer the question, let me take the call and we'll take the question after. Calling live, where you calling us from?
Yeah, Brooklyn.
Brooklyn, New York. Go right ahead.
Yeah, Junior. You know when we was growing up, old people, our parents always used to tell us stop masturbating because your sperm count will get low or you will go blind as the older you get. So ask the doctor if that's true.
All right, right. So he's asking when he was younger, and old people used to say, don't masturbate, otherwise you'll go blind. Oh,
oh.
does that have any facts, truth to it?
No, no, it does not. It does not. I think that was just a scare technique during that time. But I got my girl Jill Kennedy. She's on the line. She's got some reminders for me. Just to remind you guys that I got my Sextevia. There you go. That Sextevia can help them in the bedroom too. She's one of my good friends, and the Sextevia is my all natural. I have the water base and I have the oil base, and you can go to my website to purchase that. I only ship in the United States. So if you're, in the Grenada and so forth, I can't ship there. But yeah, so check out my website, sextivia.com, SEXTIVIA.com. And then you'll find my masterclass to the orgasms on my website as well, drkatinaKennedy.com. Everything's on my website, y'all. So go check it out, and then make sure you follow me on IG.
Okay, good, good, good. That Raul Junior asked the doc to comment on theory that all penis and vaginas are not equal, as reference to sexual performances.
All right. So that basically means, this is from my interpretation from that question. I think he's saying that sometimes the penis can be too big for the vagina. Some women have smaller pelvic areas, smaller vaginas, which they can't take the certain size of the penis. no matter what. I actually had a couple where they struggled with that. Every time they had sex, she was in so much pain. She never got used to, thank you for pinning that, Gail. She never got used to his penis size, no matter what. And it was always so painful. So she didn't actually enjoy it. And they end up getting a divorce over time, unfortunately. But yes, so the body frame, most of the times, the vagina is resilient. We have vaginal births, we
Yeah.
have a huge baby that come out,
Hmm.
our pelvis area adjusts, and then it snaps back, right? Yes, it does. So it can adjust, but sometimes too it's mental. There is a condition called vaginismus, and what that is that's anytime the penis begins to penetrate the vagina closes. It's called vaginismus. It spasms, right? So that is a chronic condition, and sometimes some patients need like Xanax to help relax them, wine, something to help relax, so that when the penis tries to enter, the vagina won't spasm or it
Hmm.
won't contract. So
I
that
see.
is a condition.
Rona wants to know what causes bleeding during sex.
Oh, this can be so much. That's one of my top videos on my YouTube channel. So if you want to look at all of my YouTube videos over all the years, I talk about everything, y'all. Excessive masturbation. I talk about fibroids. I talk about bleeding during sex. Check out my YouTube, and that one's just Dr. Katina. So go to YouTube and then search Dr. Katina, Drkatina. I'm telling you, that's where all my videos are. But
Hmm.
to answer that question, that can be sometimes if you're dry, okay, if you're dry and you're having sex, you get tears of the vagina, right? And that causes the vaginal bleeding. Also, if you have polyps of the cervix or the uterus, that can cause bleeding. If you have what they call a friable cervix, where your cervix is kind of inflamed because you have some type of infection, it can be an STD. Oh, we never got to that STD question,
Yeah,
Julia. Just thought about it.
right. We
It
gotta
can
get
be
back.
an STD or a normal vaginal infection that can cause it as well. And then those dreaded fibroids. If you have fibroids of the uterus, that can cause bleeding during sex as well.
Right, right, right. Okay, there you go.
Oh,
That's so somebody the STD question now.
yeah, so going back to that, some of the things that, remember, there are so many different STDs that are out there, So first of all, you have to educate yourself on that. I actually have a book that's called "Let's Talk Sex and STDs." I published that some years ago. That can be found on Amazon, but
Hmm.
it's called "Let's," and I talk about all the different types of STDs. You have condoms. Unfortunately, can't uh, prevent all STDs. So, say for instance, if you have a genital wart on the scrotum, on his balls, if he have a genital wart down there, and the balls is banging on the female vagina, if he has a genital wart, guess what? You just got genital warts, because genital warts is transmitted from skin to skin contact. So it's so important, ladies and gentlemen, before you engage in any type of sexual activity with your partner, don't be afraid to look at it. That's right. Look at it before you put your mouth on it, because you can be contracting herpes that way, and you can contract genital warts that way as well. And then, of course, gonorrhea, chlamydia. Now, if you do have a partner where you're just kind of, having fun, don't forget to use your dental dams. People forget dental dams are used, is like the condom for oral sex. So get your dental dams for oral sex so that you know that you're protected all the way around there. But yes, so you just have to make sure you got HIV, you got hepatitis, you got, and the ones, like I say, you got your gonorrhea, chlamydia. Syphilis is very prevalent.
Hmm.
Syphilis is coming back around. I'm seeing that more and more. I am giving injections more and more for that. So yeah, yeah. So Jill says, set my sex party class. Jill, I don't have that yet, but I guess I can I'll have another one. I do have my team.
We
I
should set
have my
that up, doctor. We should set that up because I
I
want
know.
the Ride Along family to be a part of that as well.
Yeah, yeah.
Sex party. But here's what another thing I want to ask you. Sometimes women get insulted when you. I mean, I just showed it earlier. You like, okay, let me take a look. Let me. I mean, I'm gonna put my mouth there, so I gotta make sure that. And some women don't like that.
Well, you want to do it in a nice way, of course. You got to do it discreetly. Women, before you just put your mouth on, on the penis, take a look. Make sure he doesn't have any genital warts. If you don't know how genital warts look, make sure you go Google right now so you can see, so you'll know what you're looking for. But yes, you have to just do it nicely in a discreet way. And
Mhm.
then you have to take accountability for yourself as well, ladies and gentlemen. That's why I say you have to look at yourself and you have to take a mirror, take a picture every day and look at the vagina. Spread it apart, ladies. Take a look. Men, look at your penis. All right. If it's any cuts or anything like that, you need to seek some help.
Yeah, yeah.
Yeah.
Take a picture. A lot of them know how to take a picture, doc. Because I tell you, one time, I don't know if I told you, but one time this lady sent me a whole bunch of pictures, and I'm like, "What the hell? What kind of freaking pictures are all kind of nude pictures?" And then she said, "Sorry, I sent it by mistake." Doc, where she thought I was a gynecologist, a kind of physician, or some kind of therapist, a occupational vagina reconstructionist. Doc, I
Oh
said,
no, Julia. I think she was trying to flirt with you.
Doc, you don't flirt by sending people a picture like that, Doc. It was, Doc, it wasn't like, I mean, she probably thought I was a reconstructionist. Let's put it like this. Like,
Oh
yeah,
my
I
goodness.
couldn't do nothing to help. I was like, wow, that's all I
So
could have said, Doc.
Spice,
Wow.
Spice, what caused a woman's vagina to get so rough sometimes? So the roughness comes from when you're pretty much dry, when you get a little dry. So sometimes certain medications, sometimes a decrease in the estrogen levels as you get older, the estrogen decreases. So your vaginal secretions, you're not as lubricated anymore. Sometimes I know a lot of women, unfortunately, when they bathe, they actually take the rag and they put it inside of the vagina. And that's not the right thing to do. Yes, yes. You will be surprised at a lot of the things that I've encountered over the years in my practice. But yes, you definitely those are some things that can cause that. Sometimes smoking can cause the roughness of the vagina. But yeah, so make sure if you're having some lubrication problems, your 100% coconut oil is good. And then, of course, my Sextivia. I gotta sell my Sextivia, y'all. Y'all go purchase my Sextivia. That's my all natural personal and personal lube. It can be used vaginal and anal, and as a massage oil as well. So, but yeah, so that's the answer. Yes, Spice.
Yeah. Guys, if you have post your question. We're gonna try to get to some more of the questions right here. Or you could call in 718-701-5720. Now, Doc is not here all the time, guys. The next time Doc might be here is another 3 months or so. So take advantage of the opportunity. Call in 718-701-5720. Ask your question, or post your question right there. We're gonna try to get it. If you're listening on J107.9, you could call in the number 718-701-5720. Doc, is your question?
Yeah, now Spice came back with that follow up and said, "Can lack of sex cause the roughness of the vagina as well?" And yes, that can as well because the vaginal walls they atrophy, they shrink. So if you don't use it, you lose it. So yes, that's a good point, Spice. So I'm glad you came back with that one. But yes, it definitely can. You have to constantly lubricate, massage, just bring the vagina to life because if not, it will dry up.
Yeah. Yeah. You don't want that. Dry up is no good. 1-870-15720. We're taking your question here, guys. We almost at that point. All right. Claudia says, and anal sex, you have to use a condom.
So if you're with your if you have a committed significant other, then you guys probably not using condoms. But for the most part, if it's just someone that you're not committed to per se, just a booty call or whatever, you may want to use a condom. But just so you don't always have. You do have to prepare for anal sex, so you have to make sure you clean the anus out. So some people do that by doing the flea enema to clean the anus area out. Some people need the numbing cream as well for the anal sex so that it won't be so painful. And then of course, you have to lube it up really good. But yeah, you just can't just have anal sex without preparing because you will have a lot of feces on the penis.
We
Definitely.
got a call on the line. Call it live. Where you calling us from?
I'm calling from Brooklyn.
Brooklyn, New York. Go right ahead.
Doc, I have a guy. He has a very small penis, right? And I like deep penetration sex. But somehow I'm tired of oral sex. So what can I do I don't want to get rid of him, but what can I do to change the whole dynamic?
Good question. You can add some toys in. Add some toys. So because oral sex is, you don't like it from him. He may not be doing it well, or that's just not your thing. Because some women, they like giving oral sex other than receiving. But you use some various toys. I'm not the toy specialist, but I'm sure your folks can give some good toy tips out there. If y'all have some toy tips, some good toys out there make sure y'all write it down and type it. But add some toys to it. It's amazing when you can add the toys to the bedroom. And also, just so you guys know, if you do have a partner who does not have a large penis and he's not getting to certain areas of the vagina, they do have what they call penis extenders. And you can look on Amazon. It's called penis extenders. And that's basically okay. Somebody says the bullet. So that's that toy, the bullet, the rabbit. See, I know Candy Kiss. She knows all about them. I love it. But they have penis extenders that you can put on the penis, and that extends the penis, and that way you feel a little bit more pleasure. Ladies and gentlemen, there are many things out there sexually. They even have a finger condom. Yes, a finger condom. So if because you can get certain bacterias and things if you fingering someone, a female, if the finger is not clean, you can get certain bacteria. So some people have to use finger condoms.
Yeah. So caller.
Yeah.
Is it to the point where you feel like you can't go forward with the relationship because he has a smaller penis?
No, he's somewhat old-fashioned. Some men don't like to try new things, and they like to get under the cover and the lights off, and that kind of a stuff. So
Yeah. So try to introduce the penis extender to him. See if he'll be open to that, and then also try.
He feels violated by you adding another man to me, right?
Okay, so what about toys? You think he'll be open to the toy idea? Just say I want to do something.
He's old-fashioned.
Yeah, he's gonna have to change because you're gonna have to be strict with him and say, look, this is what I want. I want to try something different. You can't be old fashioned. You have to try. So just be really stern with him, and hopefully he changes. We can't be like that in relationships. So if you're like that,
I don't want to try. You try lubricant just to make life a little bit smoother for you as a woman. And he's like, oh, I can't function with this. I can't function with this. I'd be like, what the heck? This is like bare water.
How long is his tongue? How long is his tongue?
Long enough, but something to just get tired of the shit,
She's saying, I don't want no more of the tongue. She wants to try something different. So try those things I just recommended, okay?
Okay, all right. Carl, thank you so much for calling. We really no, I'm not laughing at you. We're really trying to help you. We wish you all the best. And you know what, Doc? There are plenty women out there going to the same thing. A lot,
Yeah.
a whole lot.
So
A whole
these men they have to stop being uh stubborn. Men, you have to start pleasing your woman and stop being stubborn because that as sometimes the older the woman gets, the more sexually explorative she becomes. So you're gonna have to adjust with the times.
Doc, it's always a pleasure having you on here. We gotta cut it off here because we're gonna have to see you in the next 3 months again.
Yes, definitely. I wish I could come on more often, but life is busy
I know.
and it's crazy. But I'm such a pleasure to be on here every time I come. I always have fun with you all.
It's always a pleasure, Doc. And give the folks information where they could contact you again. Give them the information for your IG, your YouTube, everything.
Yes, so let's go. So YouTube, Dr. Katina, DrKatina. All right. And that's where you can see all my past videos. I'm telling y'all want to see over the years. I go from back to years. And then you go to my IG. That's my up to date. I give a lot of fitness and health tips on there because I'm into fitness as well. I work out a lot. So that's IG at DrKatina_DRK. That's my IG. And then, of course, the website where you'll find all about my books, my sex parties, my teen parties, my Sextivia, my orgasm masterclass. You go to drkatinakennedy.com. And it's been such a pleasure. And until next time.
Thank you, Doc. We always appreciate it. Keep in touch, all right? Thank you so much. Yeah, that's Dr. K. Always a pleasure having her on. It's really all her links. We have we're gonna put her links in on the page. You guys could click on, check it out. Our master class and everything. Yeah. 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 Yeah, the website is drkatinakennedy.com. I'm going to put the YouTube channel there. You guys could check out. I swear, Dr. K shoots straight to the hip. She don't bullshit around. She don't dodge around. She goes straight to it. It's kind of gynecology professional that you want. Yeah. Yeah. All right, guys. It's Friday. Now, listen, tomorrow I'm going to be traveling, right? Tomorrow I'm going to be traveling. Hopefully I get to my destination in time so I could do Right Trivia. If not, we're going to do it a little bit later. But tomorrow I'm going to be on the West Coast, so all the fans and supporters over on the West Coast, we're going to be possibly linking up on Friday. And I'll be back again on Monday, possibly late. But so if I'm late, after the 6 o'clock hour, Ride Along Live would be about 9 o'clock. 7 o'clock on Monday, right? All right. Thank you so much for watching. Thank you so much for being a part of our program this week. Thanks to our producer, Lois JJ, always working hard, making sure that we're packed with variety programming, not one set of topic, but a variety of topics, and keep people's mind active. They are going through a lot at this point in time, but we're not forgetting the people who are going through the COVID right now. People are in isolation. People are in quarantine. And we also have to send a prayer to the families who just lost their loved ones today. All over the Caribbean, it's and all over the world, it's happening. We send out our condolences to those families. Guys, protect yourself, protect your loved ones, look after your neighbors. All right. Thanks to our moderator, Gail. You work hard today, Gail. What? Yeah, you work hard today. Kibbs, Deanne Fraser, everyone, all supporters, family and friends, thank you so much for being a part of the Ride Along family. Catch you guys again tomorrow, hopefully, from the West Coast, West Side.
Now that total lockdown over, I go take advantage on the thing when I hold ya. Cause woman, to be honest, if I don't release a go dead. Woman, to be honest, if I don't release a go dead. In less than no time I gone down in the meat, down in the meat, down in the meat, down in the meat. Stop at a papa man from the light, I don't see. Since you love the job so much, give him what he need. Now that kid give we a blind, time for me get my blind, put your 2 foot up in the sky. Maybe you're something tight like the coffee in the night. Hey, 2 months without your selfish, you man.
Get your PCR test in 30 minutes or less. Visit www.allprolab.com.
Williams Funeral Service serve you with dignity and compassion as you mourn. Every day, we embark on the journey of life, and one day, the journey will end. It's on that day that you can entrust the celebration of life of your loved ones to David Williams Funeral Service. Call 718-291-3823.